We're excited to start off 2023 with talking about poop, one of my favorite topics. So thank you so much for coming here.
Thank you so much.
All right, I'll be back.
Hi, everyone. So thanks for having me. I will be talking sort of in general about poop and poop-related issues for babies and toddlers and older kids and whatnot, but please let me know if there are any specific topics of interest. Starting with baby poops, because this is one I get all the time. What is normal for a baby? So when your babies are born, there is one first poop that is really monumental called meconium. So that is that very sticky tar-like black poop that we look for in the hospital. This is totally normal. You should see this typically within the first 24 hours of your baby being born. Some of the babies will actually pass this as they're being born and even have some respiratory issues. So hopefully it comes out once they are out in the open air and you see that nice sticky black meconium that is very difficult to clean. And everybody's cheering because on the doctor's end of this, we're excited because we know the tube is connected, right? So the mouth to butt, everything is open and things are passing through. So if you do not see that sticky black poop when you were in the hospital, I would say up through the first 48 hours, you should be asking your pediatrician about potential things that they should be looking for. So there are, again, very, very rare things that may cause delayed passage of meconium, things that are genetic and anatomic issues. So again, I would hope that everyone passes it totally fine. But after that first sticky black meconium, the poops really range in color, in texture, and frequency for little babies, really from a yellow kind of seedy sort of color and consistency to green and to brown and to kind of all the shades that are fun in between. When your babies are having, let's say, pale colored stool, which none of you should ever see, and I hope none of you will ever have to deal with this, but if anyone's seeing a very pale color stool, similar to, let's say, the color of the exam table, that would be something that you'd want to speak with your doctor about. So that could be a sign that there is a blockage somewhere in the biliary ductal system where you excrete your bile. Again, this is incredibly rare, but it's super important for babies to be monitored for this. And if you're ever unsure if the poop is very pale, just bring it to your doctor's attention, take a picture, take a sample of the poop, and bring it in so that someone else can take a look at it. In the breastfed babies, often we have more frequent stools, and you can also have more infrequent stools. I know that doesn't sound helpful, but anywhere between 5 to 7 poops a day to 1 poop every 4 days or once a week even in breastfed babies can be totally normal. So any of the normal yellow, greens, browns, I would say are totally fine, and the poops should be coming out easily and soft. If your babies are looking like they're struggling to push out their poops, and a soft poop comes out, or a pasty, mushy, soft poop, which is what we would expect, then that's normal. There's actually a term for babies who are pushing out and looking really uncomfortable. So they're pushing and straining, and you feel like they're going to get out this monster-sized adult poop, but really it just comes out as a little baby poop. That is called infant dyschezia. Infant dyschezia. It's a fancy word for the discomfort that we see in babies who are trying to learn to poop. And really, this is not something that needs to be treated. It's something that they're learning. So they're learning how to coordinate their muscles and the act of pushing down and of pooping. So if this is something your baby's struggling with and they're still pooping every couple of days and a nice soft poop comes out, that should be totally fine. There's no need to do, rectal stimulation or suppositories or whatnot in those circumstances. Again, speak with your doctor about any of this, but I would say in the vast majority of circumstances, this would be a form of normal, so we're not concerned. People have a lot of concerns about specific colors that we don't find concerning, but I know that you're always nervous about. So green poop really doesn't mean much. It may mean that poops are coming out at a faster rate or nothing, and it may mean nothing at all, and that's totally fine. But really, we don't make much of green poops, any shade of brown, any shade of yellow. It's really more of an issue texturally, I would say, if things are super watery, like there's no texture of poop above the diaper, or if it's super hard in an infant, that wouldn't be normal either to have a formed hard poop. Or the color, I would say, black poops in, I would say, typically older kids. Again, very rare to have truly a black poop from something not related to a medication or a food that they're eating, but truly black poops would be abnormal. Very pale poops are abnormal, and red can be a sign of bleeding, but it's hard to tell if it's blood versus other things. So again, it can be related to a medication or a food dye. So if you're seeing anything that looks like blood, definitely take a picture, save the diaper, and bring it to your doctor. Poops for babies with cow's milk protein allergy or allergic proctitis or whatever you want to call it, milk soy protein intolerance. This is typically something that you're going to see around the 8 to 10 week mark, sometimes 12 weeks is the range. Some babies have really loose stools. Some babies will have hard stools. Some babies will have terrible reflux. And some babies just have blood in the stool, and that's sort of what we go by. You can have this with breast milk, breastfed babies. You can see this in formula-fed babies. There's very sort of a huge host of different treatment options for both of them in terms of changing the diet for the mom or for the formula and whatnot. So definitely important to speak with your doctor if there really is true hard stool constipation or any significant blood in the stool or streaks of blood that you're seeing. Typically in infants, you don't need to frequently check the stool for, other sorts of tests and things, even for blood, unless we're not sure, if there's something allergic going on. But again, bring a sample in and your doctor can help decide if it's necessary to do more testing. For the older kids, so toddlers also have a huge range of normal for their poops. I would say a happy toddler should poop every day. Some toddlers poop a couple times a day to every other day would be sort of my norm. By day 3, 4, I would prefer that they have a bowel movement so that things don't get super hard and backed up and painful. If your toddler is having frequent watery or frequent mushy loose poops, of course it matters sort of based on circumstances if there's an infection, but if this is a chronic issue, and again, we're sort of differentiating between chronic diarrhea and acute diarrhea, that would be a huge differentiation for what we're dealing with. So the acute and sort of sudden onset things would be something like an infection or either foodborne or virus or bacterial or whatnot. But if we're seeing chronic diarrhea, often in toddlers, we see something called toddler's diarrhea. And this is really in kids who have no other sign of any medical concerns. They've been growing and gaining weight and thriving, and they're just having these really loose bowel movements. And often this is a matter of the diet. So if kids are drinking a lot of juice or a ton of fruits, it has what's called an osmotic effect. So it works sort of similarly to a medicine like Miralax, where it pulls water into the colon and then has things run through quite quickly and very soft and mushy. If it's not a fruit juice or a fruit issue, sometimes it's actually a matter of being on a low-fat diet. So if your kids are just sitting there eating carbs all day and goldfish, and they're not really getting some healthy fats like milk fat or avocado or things like that, things will be moving quicker. So when you eat fat, it slows down the intestinal tract. So that's something I see a lot of as well. Potty training. So potty training, I would say, is often the age when I see kids become very constipated. And this I could talk about for hours on end, and I do, and I'm happy to chat with anyone who has other concerns about this in detail. But really, potty training is a turning point for kids and for toddlers, and for pooping, it often isn't as smooth as we would like. Poops, or metaphorically. So we really need to be sure that our kids are having enough fiber, enough fluids, enough motivation to let out their poops, because it's often very daunting and scary to poop on the toilet. And, if they are someone who's been holding and they get constipated, then it's just this cycle of fear and retention. So I remember that one big hard poop I had, I'm going to hold it in so that I never poop again. And obviously that's not going to work in their favor, but they don't understand that yet. So we need to give enough fiber and fluids, and often supplements or medications, as advised by your doctor, on how to get them pooping. So you may need a bit of help through the potty training period. And I would say all low stress environments will work in your favor. Pushing a kid to sit on the toilet, or forcing them to sit on the toilet, or making them feel bad for, having accidents, all of that works against us. And remember, your kid is a toddler with a not fully developed brain. And I would say positive reinforcement only, and this is the one thing they can control, is when and where they're going to poop at this point. So we need to override that, and you can make your kid poop with enough laxatives. You can make your kid poop, but obviously being sensitive to their concerns, and I would say relieving the stress and the pressure of them needing to poop or poop on the toilet. And often it just needs another few months of their development to be fully ready for it. I'm getting a question: should we be concerned if a baby has a diaper blowout? Not necessarily. So every baby is totally different in terms of their volume. Blowouts happen, unfortunately, and often it means nothing. And I would say that's fine. If they're frequently having blowouts, maybe there's something more to it. But the fact that they're sort of exploding, I wouldn't be concerned in itself. If there's a ton of mucus, obviously, or if there's blood, that's a different story. But if it's like a normal mushy poop blowout, I wouldn't be concerned about that. If there's any other questions, please let me know. The older kids, diaper brands. Ooh, so we're getting a question about diaper brands. Interesting question. I do not have any medical recommendations on diaper brands other than buy what fits your kid and whatever is cheapest, and that's totally fine. There's a few brands that market themselves as being more environmentally friendly and slightly less horrific for a landfill, and I support that. But obviously, if something is cheaper and more accessible, that is fine as well. Anything else?
Awesome. I do have a question that I hear often from parents about probiotics. I've heard of parents just giving their children probiotics and without a doctor's recommendation or whatnot. So I was curious what and when probiotics are appropriate, if they are, for little guys.
That's a great question. So there's so much variation among probiotics. I would say in the huge majority of cases, nobody needs a probiotic. It's really not evidence-based for any sort of basic gut health to take a supplemental probiotic. The natural prebiotics and probiotics that occur sort of in like fermented foods that your toddler may not be eating, like kimchi and things like that, and sort of fiber in forms of, oatmeal and chia seeds, like those are the healthy sort of pre and probiotics, and yogurt and things like that. But otherwise, you don't really need one. And people think probiotics make you poop, and unless there's added fiber, that's not really true either. So I would say unless your child is sick with like an acute diarrheal illness or post-infectious diarrhea, it's really, it's not necessary. And I find that a lot of it is just a marketing ploy and a big money waster. And I would rather your kid eat some of these healthy foods instead of buy it.
Awesome. And I know you did talk a lot about colors and things like that. We did have one question that came in earlier, wondering if green poop always means an allergy, not consistent for an 8-week-old baby. What would you say about that specifically?
No, green poop doesn't really mean much of anything. So green poops can be totally normal. It doesn't mean that there's an allergy. I wouldn't worry. Depending on, I mean, obviously the age of the kid. I see older kids who forget that they ate like a green cupcake the day before or a red cupcake or something like that. So in a baby, obviously they're not eating these things, but I wouldn't be concerned about green.
Awesome.
Another question, what is normal about the amount of time for a baby to strain while trying to pass gas or poop? There's really no time limit. Unfortunately, I know that's not a super satisfying answer, but babies will strain for minutes at a time and then not get anything out, and then they'll be straining again later and not get anything out. And that's all within the normal range. Gripe water, a lot of people swear by it. I'm a little iffy on supplements, especially for babies. They're not FDA regulated. You never really know what's going into them. So gripe water always just makes me a little bit nervous, and I'm not sure how much it's doing for them. The things that really are pretty benign and safe, I would say, are something like Mylicon or simethicone, which is just gas drops. They may or may not help. For babies who are really backed up, I would say when they're old enough, would be some prune juice or mixed with water. But again, I would talk to your pediatrician before starting that. Question, breastfed baby, wondering about stringy parts of yellow poop, a little slimy. Good question. So stringy parts in the poop for breastfed babies, often that's normal. It doesn't mean that it's mucus. Stringy can overlap with looking like mucus, but if the baby is healthy and otherwise well and you're not seeing blood in the stool, I wouldn't be worried about it. Fun fact, when babies start eating bananas and toddlers and older kids, it actually looks like there's little teeny worms or even parasites in the poop. So that's totally too, like the little worms. But in any case, the little stringiness in the yellow poop, I wouldn't worry about that.
Okay, I could listen to you talk about poop all day.
I do talk about it all day. I do. I enjoy it. So if anyone has any other questions, feel free.
I have a question.
Yeah.
So my kids are older now, but you know that Frida baby,
the Windy.
The Windy. What is that? And is it safe? It makes me nervous.
It's not necessary. Okay. People love it. It's the same as putting a rectal thermometer in your baby's tush. It's really just giving them some stimulation and sort of helping them feel something there and push and try to poop it out. It's not needed or necessary. The only concern, I guess, would be if you put it in, I don't know if there's a stopper on it, like could you put it in too far or whatnot, but your baby really shouldn't depend on it, and that's why I'd rather not use them. But the Frida snot sucker, life-changing.
Life-changing.
So that one I do support.
That one's amazing.
I love that one.
So good.
Okay, what about diarrhea in a 2-month baby, sometimes brown? A lot will go into this question. So is it super watery? Is there blood in it? How many times a day? Were there recent vaccines? Is it bothersome? Is the baby gaining weight? So probably a bit more there, but I would say in the absence of anything else of concern, and if the baby's totally happy and comfortable and no blood in the stool and eating well and gaining weight, if it's loose, I wouldn't be concerned.
Awesome. All right.